Good afternoon, everybody. I'm Riddhi from Beautiful Spotless Skin Team. I'm sure all of you must be keeping good in health. To look beautiful and smart at all times is quest of humans right from beginning of civilization. Few of the common conditions affecting the look and feel of a person is acne, hyper or hypopigmentation, and even hair loss. Out of these, acne is a big concern. Acne is common skin condition that can impact anyone, whether you are a teenager or an adult. This skin complaint is no stranger. Knowing the various types of acne can help you treat the condition better. Acne is a chronic condition affecting more than 85% of adolescents and young adults. It is one of the most common diseases affecting humanity and quality of life. It goes beyond just being a skin alignment to various psychological disorders such as depression, anxiety, stress, and low self confidence. Hence, it is important to know the holistic treatment approach for this alignment. Despite its prevalence, few people know that June is an acne awareness month. Acne Awareness Month was launched to combat the negative stigma surrounding this common skin condition and also to be aware of treatment approach for acne management. So let's connect today with our skin experts, Dr. Ranjan, live from Hubli to talk on types of acne and acne management. Dr. Ranjan Jeevannavar is a chief dermatologist of skin care based in Hubli. He has completed his MBBS from Karnataka Institute of Medical Science, Hubli, and MD-DVL from JSS Hospital, Mysuru, Karnataka, and also FRGU HS in dermatosurgery, cosmetic surgery, and hair transplantation from Cutis Hospital, Bangalore. His areas of expertise are cosmetic surgery, scar revision, hair transplantation, vitiligo surgery, laser medicine. Welcome, doctor. It is our honor to have you with us today. And we'll begin with the first question. Doctor, first, please let us start. What is acne and what are the types of acne lesion?
Uh, this is audible, right?
Yeah.
Yeah. Acne is basically simple, we say pimples. That is very common in majority of the teenage adolescent people, and it can extend beyond till almost till the age of 35, where we say adolescent acne or adult acne as such. So now acne as such, you can have multiple types of lesions. Like most common, what we see in the various stages as well. These first will be a blackhead or whitehead. Those we say as comedones for us. Then we have something called as papules. Those are a little bit of a hard pimples. If at all you touch, when you see, they have a little bit of a hard ones. So they have a little bit of a reddish or a little bit skin color. Those are papules. Then afterwards you get pustules. Those are pus filled lesions. So if those things will be little painful also. Then the next lesion, if at all we have, will be nodules and cysts. See, nodules in the sense, whenever you touch and feel, if at all it is little bit extending more than 0.5 to 1 centimeter or anything. So some people will have almost all the face, or even few of them will be having beyond in these particular areas, which are very big. Those are nodules. And sometimes those big ones will be completely filled with either pus or fluid. Those are like cysts. Based on the type of the lesions of acne, whatever you have, we decide the type of the treatment, what we have to do, and also the grades are basically decided on that particular.
Doctor, what are the specific areas of face acne means specific causes?
See, this is very important actually to say. Consider that the forehead. Usually the forehead can be because if at all you have too much of dandruff, or else if at all you're getting at the hairline. So if at all it's in the hairline, it can be because of too much of usage of your hair products or oiling of your scalp if at all you're using it on a daily basis. So then afterwards, if you're using dirty pillow covers or because of your some kind of tablets or any other protein powders or any other things, those kind of causes can cause acne in the cheek areas. Then afterwards, you have acne over the eyebrows, and then afterwards over the jawline, and also extending over the neck. These areas specifically will be because of hormonal issues. If at all you have some, especially in the ladies, whenever you have an irregularity in your cycles, So then afterwards, if pain during your cycles or irregularities in your cycles, or even if you're gaining weight, or sometimes if at all you're taking some tablets also, like there are some neuro medications or even a B complex tablets also sometimes that can cause acne. So specifically, jawline acne is an indicative of hormonal acne.
Doctor, what are the grades of acne?
See, grades of acne in particular, if at all we say, so the types of lesions, what we say, right? So the first will be most of the lesions, if it is more of comedones, like blackheads and whiteheads. If they are predominant, that will be like a grade one. Then, if at all you have some lesions like majority of them are comedones and blackheads, then you have some papules, those are hard ones, skin colored ones. So few pustules, then you have like grade two. Then if at all you develop one or two nodules, then it goes into like grade three. Then majority of them, if at all you have like pustules, some big hard nodules and cysts, then we go for like grade four acne stage.
From which of the grades are like easily curable and which grade costs more time to get treated?
See, grades basically, if at all we say grade one and two will be very easy to treat and management will be very easy. So whenever we say like grade three comes, in the sense whenever the nodules and cysts comes, so because the nodules and cysts are little bit of a deep-seated lesions. Whenever you have a deep-seated lesions, you have to intervene with regards to the oral medications. Just giving little bit of a topical creams are not going to help you out. So because of a deeper set of lesions, then you have to give a little bit of tablets which goes on that stretches the period of the treatment there. So sometimes it might be reduced on in a month or it might extend for 2 or 3 months also or even 4 months also. Especially in the case of a nodular cystic acne in a grade 4 and above. We usually start isotretinoin and all. That isotretinoin course itself is almost like 3 to 4 months. You can't take it only for a short period and stop it off. See, what happens is that for you to see good amount of change itself will take 2 months there. Then afterwards, you have a lot of scars because of your deep acne. So that has to be treated. So that goes on for a period of stretch of 4 months at least.
Doctor, sometimes it happens that individuals doesn't actually know that they have diagnosed with acne. So what are the symptoms that they should know prior so that they get to know and should visit a dermatologist as soon as possible?
See, main important thing is that see most of them what happens is that self-medication in acne is too much. Okay, so they usually tend to go to a medical shop, take some cream, and then they use it. Okay, so many of the time it reduces with that also. I do understand some home remedies also will reduce down the acne. Some face washes also will reduce down acne. I do understand.
Yeah.
So the most important part here comes here is that. So I told you the grades. Grade three and above definitely requires a separate care for it. So when you have a deeper lesion, when you touch and feel that the pain is there in that particular area. So if you don't have pain in that particular lesion, so then superficial, if it is superficial, then it can be treated very simply. So if you have a deeper lesion, definitely it requires a special care first. Second thing will be an hormonal acne. So if at all you are having acne in this particular area, and especially in the jawline and involving the chin, so definitely that means there's special care in the sense we have to identify the reason why you're getting it first. So whether it's because of some medications or it's because of some weight gain or any hormonal changes is being happening in for that particular patient. So the hormonal evaluation has to be done. And if any hormonal changes has there, so that particular treatment has to be done for that particular issue. Okay. And if you have deeper set of lesions which are filled with pus, so that time what happens is that we need to give a tablet for a longer period of time. So with simple creams, it's not going to help you out at all. Okay. So if at all you're trying to treat only with the creams that time, so sometimes in a grade two and three, definitely it will reduce down, but it might take little longer time. But if at all you go only with the creams, so main problem comes here is that it might leave a scar. So without a proper treatment there, if at all you just leave it like that only, it might rupture there. So once ruptured, if at all it is not proper healed, then a bad scar will be left out. So treatment of scar will be still more difficult when compared to the treatment of acne.
Does family history matter in acne?
See, family history matters definitely. So what happens is that there are first is that some people will be having a family history of hormonal changes also,
Hmm.
family history of overweight also, family history of some food habits also.
Hmm.
So and I'll will go over that because see, sometimes what happens is that so whole family will be having a lot of sweets. So some too much of sweets intake, too much of oily intake. So in general, all of them can have a little bit of acne in that particular way. So we have to counsel the whole of the family if at all any issues are there. So or some kind of some people will be having in general all the family members will be taking multivitamins without any reasons.
Hmm.
So we need to ask all of them there.
Hmm. Doctor, as you mentioned prior, that if anyone gets diagnosed with acne and when they touch and they feel the pain, but as you said in the medical terms, grade one, if they find it for the first time ever, the individual have never diagnosed with acne and is first time diagnosed with acne. So, what things one should keep and what all treatment they should go for it and what medicine they should apply? Because they have diagnosed it for
That's
the
what
first time and doesn't know
diagnosing
what's
in
happening.
first time I do understand, but based on the level of the acne grading itself, the treatment will vary. So
Hmm.
that's what I was telling. If at all you have just a little bit of a blackheads,
Hmm.
okay, simple blackheads or mild comedones, you have mild oiliness of the face. So you don't require too much of medications as such. Okay. So only thing is that we need to see as such the patient has little bit of a sensitive skin or no. So when if at all you have a sensitive skin, definitely you can't apply salicylic acid, you can't apply an adapalene or retinol. So because you need to be very careful there. So sensitivity of the skin can't be assessed by the patient directly on their own. So if a dermatologist sees, that is a different way.
Hmm.
So for that reason, if at all you want a home remedy or something simple, so then we have to keep a simple medications. Okay? We can't give a stronger medications there. So direct first timers usually we keep a simple clindamycin gel or anything like that. So
Hmm.
we don't go for adapalene or salicylic acid or anything because we don't know how is the patient type of the skin. So
Hmm.
once they have a routine set, so then they'll know how well they tolerate a stronger cream or a milder cream. So then we can have an assessment there.
Doctor, what are the treatment options for different grades of acne?
See, that's what now. First, grade one acne as such, when we say first grade one will be majority of the comedones. So when we have majority of the comedones, see it reduces nicely with simple benzoyl peroxide. 2%, 2.5% benzoyl peroxide gel comes. So that we can apply and keep for only for about 2 to 3 hours in the evening, only on the spot application that works really good. So salicylic acid face washes can be used as a maintenance.
Hmm.
Okay, BHA face washes comes that works really good. So as a maintenance therapy as such for them, not as a serum, salicylic acid serum. So salicylic acid serum irritates for many of them if at all they have sensitivity. So some people have redness, rosacea and all. So usually I don't prefer salicylic acid serums much. Okay. So when we say for a grade two, so when you have little bit of mild papules like skin colored papules are there. So that time, so we deciding based on the number of lesions. If the number of lesions are little bit more, sometimes we add little bit of oral medications like tablets we add. So like doxycycline or azithromycin or limecycline, those tablets in the sense will help you to reduce on the inflammation also, seborrhea also, oiliness also will be reduced on, and faster reduction will be there. So there, topically, we usually I prefer little bit of a clindamycin gel there. So that will calm your skin, doesn't have much of irritation there. So otherwise, we can have little bit Abson gel, metronidazole gel. Based on the type of the skin, we can decide on that particular way. So when come we go on a higher end there, like type three, grade three acne, where you get little bit of a nodules. So when nodules and cysts will start, so there we have to assess. So sometimes we start isotretinoin course. So that will be there in the grade three and directly as such. Some people we don't start, but especially if at all it is recurrent in the grade three, we have to start something called as isotretinoin. Isotretinoin is basically something like which it's an vitamin A partner. So what it does is that it reduces the sebaceous gland activity and also clears up the pores. So when it reduces the sebaceous gland activity, the oiliness of the face reduces. and the oil gland blockage is reduced. So the new acne chances will come down.
Hmm.
Okay. So and also the pores will is cleared out. So the new acne chances for a long run is reduced. So but the isotretinoin is basically a course. So we start on a regular daily basis, then we reduce down the isotretinoin from 20 mg to 10 mg or an alternate day basis, and then afterwards we stop it. So that will help you on a long run sake. So when we go for grade 4, definitely we have to think about giving an isotretinoin there. And if at all any other triggering factors are there for the patient, especially with regards to the hormonal or any other medicines are causing it or any other issues are there, we have to evaluate for that patient and treat accordingly also.
Doctor, what are the procedures available for acne treatment?
See, procedures, if at all we say, so we broadly divide them into either mainly chemical peel or a laser procedures. See, if at all we have just blackheads and blackheads basically, whiteheads and blackheads, we usually do some comedone extraction. So sometimes there will be little bit deep-seated comedones, which will be hardly visible, or even you touch, you can see the deep comedones. So you need to extract them out. If at all you don't extract them out, sometimes it will lead to ice pick scars. So that will be in a grade 1 to grade 2 acne, their comedone extraction for almost majority of the patients we need to do. Then afterwards, chemical peel is a routine procedure which we usually do for almost all acne patients. There, we decide which kind of a chemical peel we do. See, black peel is one of the good peel which we do for inflamed acne. So when they have redness and pus-filled acne, so that gives a very good changes as such. So even if you don't have black peel, salicylic acid 30% peel works nicely. So for some people who have little bit of marks and all, we give a combination with salicylic acid and azelaic acid tea. So that also works nicely for superficial marks, also with the acne person. And if at all you have lasers, if at all you want to say, especially for the patients who have rosacea acne, so in consider like the redness is there, too much of redness and inflammation and sensitivity is there on the face. We do a lot of gold toning in the sense. That is a Q6 gold toning machine comes, and also IPL. That those are the two machines which works nicely to reduce down the redness of the face and also the sensitivity of the face. Because in those patients, we can't give too much of strong creams also, and the patient have too much of redness even for exposure to sun. So we have to give a sunscreen and a maintenance and all will be too much. So once we do a repeated session of laser, so on a long run, the patient will be benefited a lot.
Okay. Doctor, at what age can one get acne?
See, acne can start as early as 9 years also. See, even and actually to say a newborn can have an acne. So we say a neonatal acne, infantile acne, those are basically because of the blockage of regular glands. But neonatal acne for newborns and for 1 year old, we usually don't treat it. So basically, we give a little bit of wet water wipes and ice block and those things and all. It reduces on its own. We don't treat much. And once usually what happens is that some people can have a little bit of early menarche, in the sense the hormonal changes which usually the ladies and men can start. Okay, they can start as early as 9 years also, it can start 11 years also, 14 years also. So when the hormonal changes starts for the ladies, usually that will be the age when the acne usually erupts. So as early as 9 years definitely can happen.
Okay. What are the prior precautions to be taken before having acne? As to like acne is a common disease, it can happen to anyone. So, what are the prior precautions one should take care of?
Nothing much, just maintenance will be there. Main important thing is that you need to know your skin type first. So whether your skin is oily or dry or mixed, because if at all you're doing any kind of regimen, just seeing someone, so without knowing your skin type, if at all you try something, you're going to irritate your skin. So if you have a dry skin and a sensitive skin, so somebody is using an adapalene or a salicylic acid or something else, if at all you try that out, definitely it's going to irritate you more.
Yeah.
Okay, so if you have an oily skin and just use simple mild clindamycin and all, That might reduce a little bit of acne, but you will not be that comfortable as such because the oiliness will be still persisting, and you'll not have that good feeling as such with regards to your skin.
Hmm.
Okay, first you need to know the skin type. Then afterwards, how sensitive is your skin?
Hmm.
So that particular part should be known. So whenever you apply any kind of a cosmetic or anything, so a simple moisturizer you consider. If all you're using a thicker moisturizer and then you get a simple acne, so that or even an irritation if at all you get, so then you have a higher tendency of blockage of the glands.
Hmm.
So then you need to change the whole of the routine there. You can't keep on using any kind of a creams there. You need to have an acne specific moisturizer, an acne specific sunscreen for those kind of patients, and also a separate face wash there.
Hmm. Yes, doctor, as you mentioned that different types of skin. So, what about sensitive skin? So, what one should do if they have a sensitive skin and they have diagnosed with acne?
So the most important thing what comes here is that the patient will not be able to tolerate any kind of retinoids much.
Hmm.
So the adapalene or tretinoin, if at all you want to use, you need to be very careful. So adapalene usually I tend to avoid as much as possible in those kind of patients to reduce from the acne. If at all you want to reduce on the scars, then the tretinoin can be used. The tretinoin, what happens is that that helps you to reduce down the scars, but you need to gradually increase the dosage for them. So you need to increase the dosage also gradually and the timing also gradually. In the sense, what I usually give is I start the patients to use them on a half an hour basis for first 1 week. So if at all the patient is comfortable, then they're going to increase for 1 hour, then 1.5 hour, then 2 hours, 3 hours, 4 hours. So when you gradually increase, then definitely it helps out. And also you need to use a moisturizer all the time and also a sunscreen. The sunscreen I usually prefer little bit of a regular usage, like morning and afternoon minimum,
Mhm.
twice daily at least. For every 4 hours application will be really good, and an acne specific sunscreen will be really better as such for those kind of patients. So because a regular sunscreen definitely can irritate you, or even the acne can increase that. So one is the regular sunscreen usage, and any kind of creams if at all you're using, slow increasing, and then afterwards use a moisturizer. On that you can use it.
Mhm.
Preferably avoid salicylic acid serums, avoid adapalene as much as possible.
Mhm.
Tretinoin, even if it's required for scar cases, slowly increase them.
Mhm. Doctor, what are the food diet one should maintain to avoid acne? If person is diagnosed with acne again and again, so what are the food ingredients one should maintain to avoid acne?
See, diet definitely is a very important part with regards to the acne, and now many of the patients are coming out because of PCOS, especially the ladies now, because of the hormonal changes, the acne are increasing. So whenever you have a PCOS or even in a general as such, the acne can increase with the high calorie diet, especially with regards to the sugar. When you're having sweets and chocolates or pastries on a regular basis, definitely that can increase your acne on throughout your life. It's not only in your adolescent period. If at all you are having your too much of sugar in the 35 or 40 also, you can get have acne. You can have acne as such.
Mhm.
Then what comes here is that dairy products. Dairy products is little bit of a confusing thing because so it's not like for everyone acne can be there because of the dairy products. Especially the most important thing is a cheese. Cheese can trigger acne for many of them as such. So some people can have it because of the milk also. Some people can have it because of other dairy products and cheese as such. So
Mhm.
I've seen a lot of men especially getting it because of fried items, especially when they have too much of oily food. That
Mhm.
can have acne as such for them. So when you're getting acne over the chest and back, so especially in men, so when they reduce down the diet, it the acne sound is seen to reduce very nicely, and for long run it doesn't recur back in men as such.
Doctor, as you mentioned about specific parts of areas of men's, as in like chest or somewhere, so what are the major areas one can have acne except face?
See, for face, apart from the face, what we usually see is the chest and back.
Hmm.
Sometimes the patients can have over the shoulders, and these can extend over the sides also, the forearms. So
Hmm.
the arms, on the sides of the arms, that can be a regular acne also. Sometimes we say something called as keratosis pilaris. Keratosis pilaris, you can see there are a little bit of a black dots. You can have a spiny little lesions. So when you touch and see, there will be little small tiny bumps as such. So those are something called as KPs, what we say. They are related to acne, but not related, not actual acne. But for them also, the maintenance will be a little bit same.
Hmm.
Okay. So some people can have exacerbated pimple-like lesions over the scalp also. Okay,
Hmm.
even in the hair areas, the
Hmm.
whole of the hair areas, you can have acne problem.
Hmm.
Okay, so diet modification and treatment with isotretinoin and treatment with other tablets will go hand in hand for those kind of acne also. Because what happens is that whenever we have a large area to be treated, so topical application will become very limited as such. We will not be able to give you a strong set of creams for a larger area. So we have to treat with the oral medications more first. Then the most important thing there becomes is that the lifestyle modifications.
Doctor, what suggestion would you like to give to the females who have menstrual cycles and although every month they go with acne diagnosis? So, what would you suggest to them, and what care should be taken by those females?
See, ladies, especially if at all they're getting acne almost every time and the periods are nearing. So
Yeah.
we need to identify if at all their cycles are abnormal or not. If
Hmm.
your cycles are completely normal,
Hmm.
then you're getting acne. So it means that the hormonal variation might not be too severe. Okay,
Hmm.
so that we'll give you hormonal tablets there. Okay, so that time what happens is that we can't give too much of hormonal medicine, so lifestyle modification becomes more important. So there two things comes into picture. First important thing will be exercise always. Exercise helps a lot to reduce down the hormonal issues. So
Hmm.
exercise basically you need to have something which will give you a good amount of sweating. You
Hmm.
can do any kind of exercise. I'm not going to specify as such, whichever you're comfortable with. You can
Hmm.
run, jog, you can do an aerobics or any Zumba or anything. But your good amount of sweating should be there. Two aspects is that one is hormonal issues also will be cleared out, and also the pores as such will be cleaned. So sometimes what happens is that even the cosmetics also can cause acne. Okay, so when you're using on a concealers on a regular basis, and if you don't use much of makeup remover and all, so that also blocks up your pores. That causes acne. Okay, so if at all you're sweating nicely on a regular basis, that also clears up the pores, and the chances of getting reducing acne also comes down if you sweat a lot. The
Hmm.
second thing where if for menstrual related acne will be diet. It's the same thing. No sweets, no chocolates, and also cut down on the cheese and the fried items.
Hmm. Doctor, since ladies have most of the acne issues, can they use makeup when they have acne?
See, makeup is an definitely. I can't tell them don't use it. All of them are going to scold me. So the most important thing is that what kind of makeup you need to use. Okay, the makeup whenever you're choosing a makeup now, so they would have written down non-comedogenic. So that particular word you need to find out.
Mhm.
Okay, non-comedogenic will be written on them. So that if at all you have an acne-prone skin, that is one of the important thing you need to find whenever you're choosing one first. And whenever you're taking a makeup, right, you need to avoid an oil-based foundations and oil-based concealers. You have a lot of powder-based foundations also, powder-based concealers also.
Mhm.
Okay,
Mhm.
so after you use, you see, always you need to use a primer and a moisturizer whenever you're doing a makeup there. So after that, you can use a sunscreen on that. When you go into a foundation and concealers, and you want to do changes in the lines and all. So just use more of a powder-based ones instead of going oil-based. And always use a makeup remover. I usually prefer a micellar water instead of using the rose water is also fine. I do understand. Micellar water would be a better choice. In the night, on a daily basis, use a regular cleanser, then use a micellar water, clean up the whole of your makeup, use a moisturizer again, and extra if at all you're using any other thing, and then go to bed.
Thank you so much, Doctor. This was a very informative for all the viewers who are females. They have been using makeup and now they are like very free, good to go to use makeup even if they have acne. Doctor, what is the maintenance therapy in acne?
See, maintenance therapy, I would rather suggest it's very important here. See, what happens is that there is a lot of things coming in Instagram and YouTube these days about serums, I'll tell you. So about niacinamide serums are there, vitamin C serums, and all those things are coming up. See, I'll tell you very clear cut. Serums are basically for maintenance. These are not for treatment. Okay. So usually, if at all we want to give a strong active ingredient, we give in terms of creams. We don't give as a serums to be used regular.
Mm,
Okay. So I would rather prefer once the patient has reduced on your acne, if you don't have any kind of scars. Okay. If you have any scars, we give little bit of a maintenance with regards to retinoids there.
mm,
If you don't have any scars, it's just to maintain with regards to the acne. Then we have two things. One will be a
mm,
face wash with regards to a salicylic acid, or with a glycolic acid combination. One face wash would be a better choice because it clears up your pores and reduces your oiliness, so that maintains your face.
mm,
Okay, but I prefer not to take a salicylic acid serum there.
mm,
So, on salicylic acid shouldn't be kept for a longer period of time on your face. That might irritate you. So, salicylic acid face wash, it will be there only for a short period of time. Doesn't irritate. It does your work, and it will be beneficial for you. And in terms of serum as a maintenance, if at all you want, niacinamide serum would be a better choice.
mm,
Niacinamide serum, you can use it on a daily night basis on a layer of moisturizer regularly, at least for about 3 to 4 months. Once the acne is reduced down, you can do that. Not any other serums. Okay. Plain niacinamide, or if at all you want a combination along with that as in vitamin E and hyaluronic acid, if at all you have a sensitive skin. So those would be a better choice than anything else.
mm. Doctor, a person diagnosed with acne, what ingredients should be added in their face wash and how frequent they should use their face washes? As it is mentioned, like 2 or 3 times in a day is better, but for acne diagnosed person, how many times a person should use a face wash and what ingredient should be added in their face wash?
See, face wash is also a big topic actually to discuss. See, face wash, I'll tell you, if at all you have a very oily skin, then comes here is the HA face wash, like salicylic acid and a glycolic acid face wash. Those things as a maintenance helps a lot. Okay. Then, if at all you have a little bit of sensitive skin and still having acne, then you can have a face wash which has little bit of niacinamide and a tea tree oil, and also we have little bit of a creamy wash with benzoyl peroxide. Those doesn't irritate you. Those doesn't irritate you much. Still does your work. Some of the soft mild face washes are there with lactic acid also. Those are also fine. The most important thing is that you need to wash only like twice or thrice. So some people have a habit of you washing your face at least like 4 5 times. So that I usually tend to avoid. See what happens here is that so definitely when you wash your face, the oiliness of the face comes down. Okay, so you'll have a feel good factor so that you feel that it's really good. So when you wash your face, the whole of the oil is reduced down. See, oil is actually required for your skin. So oil is actually produced by the skin as a protective film. Okay,
Yes.
it protects the skin. For that reason, the oil is produced. Okay, so you can't wash the whole of the oil completely. So after you wash your face, little bit of the oil is produced later on, definitely. But if you wash it on a regular basis, what happens is that the skin will sense that the skin is too dry.
Yeah.
So that becomes a reflex phenomenon and it produces more and more oil. So you need to avoid washing your face more than twice or thrice.
Okay. Thank you so much, Doctor. Your all the answers are so informative that we have bunch of questions coming up with from all the viewers. And first we have Harshita Singh. Her question is: do breakout just mean don't wash your face enough?
No, 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 no. See, it's not all the time. some people, if at all you're maintaining a healthy diet and everything, if each and everything is clean, so
Hmm.
sometimes people you're having small breakouts can also because I told you like dirty pillows. If
Hmm.
if at all you're not maintaining it clean, if you're
Hmm.
using too much of makeup or not cleaning the makeup, all those factors can be there because for the reason for a breakout there.
Hmm. Thank you so much, Doctor. We have one more viewer whose name is Sonam Sarthi. Her question is, Doctor, what diet should one follow for resolving acne problems?
That I think I've already covered it up.
Hmm.
So the most important thing, same thing like sugar. The most important part with regards to the acne is sugar. So because the sugar directly it also increases your acne. And second thing is that the sugar, what happens is that if at all you have the hormone related issues, the sugar definitely causes a spike up in your hormone levels.
Hmm.
So that causes a recurrent acne for you on a later date too. And even a weight gain also causes acne. So when you're having on a sugary diet on a regular basis,
Hmm.
definitely there are multiple things which occurs in your body. For long run and short term, both the things acne will be there.
Hmm. Thank you so much, Doctor. We have Kirti Kapoor. Her question is, hello, Doctor. Does drinking water and keeping her body hydrated will help her in reducing acne?
See, definitely if at all you're hydrated well, there are many benefits as such. It's not like over hydration causes reduction in acne. Okay, so dehydration definitely causes little bit of issues and hormonal changes and other things and all might cause little bit of increase in acne definitely, but increase in water intake definitely will not make much sense for reduction in the acne per se.
Okay. All right. Thank you. We have Deepak Yadav, whose question is, which sunscreen one should apply in the rainy season, which does not come out in the rain?
See, actually, to say we don't have a complete water resistant sunscreens much. Okay, so see, if at all you have an what if you have acne, so we usually have an acne UV sunscreen, acne UV gel and all, which works really good. So that's a matte finish sunscreen and works nicely. And we have few zinc oxide based sunscreen, pure mineral sunscreens also. So pure mineral sunscreens will stay for a longer period of time and doesn't wash out. If at all you say, if at all for people who go too much into sun and like especially for sportsmen, so you can see they apply a little bit more whitish sunscreens.
Hmm.
So they apply whenever you can see that something is visible on their face whenever they go much into the cricketers as such. So because they use more of a mineral-based sunscreens than a chemical sunscreens.
Doctor, we have one more question. How should we go about anti-aging routine when you are caused with acne treatments?
See, anti-aging routine I wouldn't say much as such because most of the patients who have acne will be youngsters.
Hmm.
So whenever you are in the 20s and all, I don't suggest to start a strong anti-aging regimen.
Hmm.
Okay. So because you already have a lot many things to take care about, an anti-aging regimen, what happens is that this is a regimen which you want to use it for at least for about 10, 20 years. This is not like you want to do it for about 2, 3 months and stop it off.
Hmm.
Okay, so anti-aging regimen, I'll tell you very clear cut. The most important thing which will help you as an anti-aging will be a sunscreen. Okay,
Hmm.
so it's not about your retinols or vitamin C or anything. These are just add-ons. See, the
Hmm.
most important factor which will cause aging will be your sun and also your infrared rays, which is coming out from your mobile and laptop screens. Okay, so the infrared rays coming out from the whole of your house and also the UVA rays, especially not like UVB rays. In the sun, the UVB rays causes the tanning, and the UVA rays which is there that causes little bit of the faster aging process. So if at all you're using a sunscreen on a regular basis without fail, morning and afternoon without fail, so that itself will help you a lot with regards to slowing down the aging process. So if you're in the early age group, like in the 20s and all, you can start like vitamin C only. Don't start retinols that early. Okay, so if you're beyond 30, then you can think about starting the retinoids, which you can do it like, so starting you can do weekly twice or so. After the age of 35, you can do on a daily basis.
Okay. Doctor, what other lifestyle changes would you recommend to keep acne at bay?
See, one thing, some people definitely get acne with regards to the pillow covers. So you can change your pillow covers to satin covers. Cotton pillow covers definitely get dirty, and that will cause acne. Okay, satin pillow covers definitely helps out. And sleeping early helps a lot. Okay, so some people say that 8 hours sleep, we sleep 8 hours, but they sleep around 2 o'clock, 3 o'clock, and get up late. So that is also a not good habit actually to say. So that changes your hormone your cycles. Okay, so even though you sleep for 8 to 10 hours, so that is not that is going to damage your body. So you need to sleep early and get up early. So that also makes a lot of sense. And at least half an hour to 1 hour of exercise. So that at least has been already told. Diet is very important. So apart from that, these are the things which you can follow.
So right now we have a lot of teenagers who are listening with us, and all the viewers around like the age group of 25s and 35s who have a habit of sleeping at 2 o'clock or 3 o'clock, and they wake up late and complete their 8 hours. So this is a good point for everyone to know that sleeping early and getting up early is the best remedy for all the causes. So not just 8 hours, but sleeping early and going to wake up early is very important. Doctor, what is a closing remark for all our viewers?
See, and the closing remark, the most important thing is that acne is common for everyone. Each and everyone will have one or two acne throughout your life. It's not that anyone can't have acne at all. So whenever you have acne, don't pinch them so that it will not leave a scar. So if it is mild, you can just do little bit of a milder, simple regimens. If you have acne over the jawline and the chin, definitely go and take a treatment so that so it will not cause further issues because hormonal issues, if it is there, it will lead into other issues like increase in facial hair, reduction in the scalp hair. So the acne will be the initial point. See, it starts with the acne, then it goes for other issues. So when you get acne, so that time we'll get to know that the patient is starting with the hormonal issues. So then we can treat for that. So the other issues also will not start for that patient. Okay. So then afterwards, just maintain a simple routine with regards to the exercise and diet and sleep. That the lifestyle is one of the most important thing than the medications for having a acne-free life.
Thank you so much, Dr. Ranjan, for your valuable time. It has been a very informative session for all our viewers. It was great to hear from you. We really look forward for many more such sessions for the coming time with for all our viewers and with you. Thank you, viewers, for your active participation for today's session, and stay connected to our beautiful spotless skin page. Have a great day ahead and take care of yourself and keep glowing. Thank you.